121. Which of the following areas of physical examination of an elderly patient is often the most difficult to accurately perform? A. Examination of the abdomen. B. Auscultation of the lungs. C. Blood pressure measurement. D. Examination of mental status. Answer: D. Assessing the mental status of an elderly patient is often difficult. It is often necessary to enlist the help of family and caregivers to accurately determine if a patient's mental status is different from the norm. 122. Signs and symptoms of radiation sickness include: A. Severe headache. B. Excessive thirst. C. Hair loss. D. Hearing problems. Answer: C. Hair loss, nausea, and vomiting are common signs and symptoms of radiation sickness. 123. Your patient is a 46-year-old male with a long history of mental illness. He appears depressed and withdrawn. Suddenly, he begins to sob uncontrollably. What should you do? A. Administer a sedative to help him calm his emotions. B. Attempt to calm him by putting your arms around him. C. Maintain a quiet, listening, and non-judgmental attitude. D. Motion to your partner to go to the unit and get the restraints. Answer: C. Allow the patient to express emotion and do not interrupt his expression with questions or comments. You should always be on your guard for safety issues when on a scene, but restraints are not necessary in this situation. It would not be advisable to touch this patient too closely, as this may be perceived by him as an invasion of his space or privacy and is not a safe gesture. 124. Depression is an example of A. Psychiatric illness. B. Psychosis. C. Mood disorder. D. Organic disease. Answer: C. Depression is a mood disorder. Depressed patients feel hopeless and helpless and manifest many physical symptoms as well. 125. What would be the reason for a paramedic to give Benadryl, diphenhydramine, to a schizophrenic patient in the field? A. To help control his or her manic symptoms. B. To help counteract catatonic symptoms. C. To raise blood pressure and respiratory rate. D. To counteract adverse medication reactions. Answer: D. Benadryl is used to counter extrapyramidal reactions in patients who are taking antipsychotic drugs. Effects noted are involuntary movement, changes in muscle tone, and abnormal posture. 126. Which of the following represents a significant mechanism of injury? A. A small child is in a 40 miles per hour car accident. B. An adult falls from a 6-foot-high ledge. C. An adult pedestrian is hit by a bicycle. D. A child falls from a 6-foot-high ledge. Answer: A. A 40 miles per hour car accident is a significant mechanism of injury for a child but not for an adult unless other significant findings, lack of seatbelts, another person killed in the same car, are present. 127. Your patient is a 10-year-old boy who has fallen off his bicycle. What should you do when obtaining the history of the accident? A. Insist on speaking only to the responsible adult. B. Suspect child abuse until the possibility is eliminated. C. Suspect abnormal musculoskeletal development. D. Obtain as much information as possible from the child. Answer: D. With a child of this age, obtain as much information as possible from the patient, him or herself. This will allow the child to feel respected and mature. The adult caretaker can fill in relevant details. 128. This child most likely suffers from: A. Diabetes mellitus. B. Diabetes insipidus. C. Seizure disorder. D. Status asthmaticus. Answer: C. The clinical presentation is one of seizures that could occur for a variety of reasons, including diabetes. However, the use of the drug phenobarbital is commonly associated with seizure disorders. 129. Phenobarbital is an example of what class or type of medication? A. Synthetic form of insulin. B. Sedative or anticonvulsant. C. Hypoglycemic medication. D. Beta agonist agent. Answer: B. Phenobarbital is a sedative/anticonvulsant. 130. If this child is on medication, why did he have this episode at school? A. Medications only limit the number of seizures a person has. They do not always eliminate the seizures. B. Medication for this disorder does not control the amount of glucose available for cellular metabolism. C. This child may have had too much to eat, overriding the medication's ability to regulate blood sugar. D. The school nurse must have been mistaken in administering the medication to the child at lunch. Answer: A. Anticonvulsants serve to limit the number of seizures a patient has, but they do not stop them from occurring altogether. 131. Treatment for this patient should include: A. A 50% dextrose solution. B. A 25% dextrose solution. C. Diazepam, Valium. D. Oxygen and monitoring. Answer: D. The medications listed in choices A, B, and C are not indicated for postictal patients who have stopped seizing. 132. This patient should be transported to a hospital because: A. He needs a lumbar puncture to determine if he has meningitis. B. Medication levels need to be determined by laboratory analysis. C. Glucose levels need to be determined by laboratory analysis. D. Repeat episodes will continue without hospitalization. Answer: B. This patient needs to be transported to a hospital because medication levels should be assessed by laboratory methods. Seizures may or may not continue to occur. 133. The ideal helicopter landing zone should: A. Contain a slope of no more than 15 degrees. B. Be an area of at least 100 feet by 100 feet. C. Be an area of at least 90 feet by 90 feet. D. Be in a fenced area for safety against onlookers. Answer: C. The ideal helicopter landing zone should be at least 100 feet by 100 feet square. Larger helicopters may require more room, so consult local air medical services if you are unsure of the size of aircraft used in your area. The ground slope should be no more than 10 degrees, and the area should be clear of debris, fences, wires, or other obstructions. 134. What is the approximate weight of the average 6-year-old? A. 45 pounds or 20 kilograms. B. 56 pounds or 25 kilograms. C. 70 pounds or 32 kilograms. D. 75 pounds or 34 kilograms. Answer: A. The average 6-year-old weighs about 45 pounds. 135. What is the paramedic's primary goal in cases of suspected child abuse? A. Gather up any physical evidence to take to the hospital. B. Ensure the abuser is arrested upon arrival at the hospital. C. Ensure that the child is removed from family custody. D. Make sure that the child receives necessary treatment. Answer: D. In many states, medical personnel are legally required to report all cases of suspected abuse and neglect, but a paramedic's first responsibility is to ensure that the child is transported to the hospital to receive necessary treatment. 136. All pediatric patients who have had seizures should be: A. Given diazepam rectally or 4 or IM. B. Transported to a hospital for evaluation. C. Evaluated for signs of abuse or neglect. D. Given acetaminophen to correct fever. Answer: B. The cause of seizure activity can be determined only in the hospital. 137. Your patient is 10 months old. He has tachypnea and wheezing and a fever of 100.6 degrees Fahrenheit. What do you suspect is wrong with your patient? A. Asthma. B. Epiglottitis. C. Bronchiolitis. D. Croup. Answer: C. Wheezing and tachypnea in a child younger than age 1 is most often due to bronchiolitis brought on by the RSV virus. Asthma in children this young often presents as coughing. Epiglottitis will often have a fever higher than 100.6 degrees Fahrenheit, and the epiglottitis patient will be drooling as respiratory distress worsens. Croup will present with junky-sounding airways and the classic seal-barking cough. 138. Cardiac arrest in young children is most commonly associated with which of the following? A. Respiratory problems or diseases. B. Trauma from automobile accidents. C. Burn trauma from house fires. D. Underlying cardiac disease processes. Answer: A. Most childhood cardiac arrests are the result of preventable accidents that result in respiratory compromise. 139. Assessment and care of a patient who is a victim of sexual assault should include which of the following? A. Perform a complete vaginal exam. B. Ask detailed questions about the assault. C. Place sterile dressings on any wounds. D. Allow the patient to bathe and douche. Answer: C. Do not perform a vaginal exam, ask detailed questions about the assault in the field, or allow the patient to change clothes or bathe. You should not overly clean any wounds you encounter, but instead wrap them up with dry, sterile dressings. Place any clothing or other evidence removed from the patient in a clean paper bag and take it with you to the hospital. 140. A patient begins to have a generalized seizure while running a marathon on a hot day. Which of the following procedures should you do first? A. Move the patient into the ambulance. B. Administer 5 milligrams of diazepam intravenously. C. Establish an airway and ventilate the patient. D. Place cold packs around the neck and under the arms. Answer: C. While the other procedures are applicable to the treatment of a possible heat stroke victim, securing the airway and ensuring respiration should occur first.